Hello, and thank you for joining today's virtual education program with Cancer Support Community Los Angeles. I'm Larissa Montalvo, and I'm the program manager here at CSCLA. I welcome you to this week's webinar titled Navigating Medicare and Medi-Cal. Today, we will be joined by Stephanie Fajuri from the Center for Healthcare Rights for a thorough discussion on Medicare and Medi-Cal health insurance, including their benefits, plan options, costs, and how the two programs coordinate with one another. Before I begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch our past webinars, please visit our website at www.cancersupportla.org. So without further ado, I'd like to welcome today's speaker. Stephanie Fajuri is the Senior Program Manager and Staff Attorney for the Center for Healthcare Rights in Los Angeles, California. In this role, she provides Medicare and Medi-Cal advocacy and counseling and conducts community education trainings on related topics. Prior to this position, Mrs. Fajuri was director of the Disability Rights Legal Center's Cancer Legal Resource Center, where she oversaw the counseling of thousands of cancer patients, caregivers, and healthcare professionals on the Cancer Legal Resource Center's national hotline. She earned her Juris Doctor at Chicago-Kent College of Law and is a member of the State Bars of California and New York. Welcome, Stephanie. We are so grateful to be hosting you today.
Thank you so much, Larissa. It's a pleasure to be here. So I'm going to go ahead and share my screen, and we can go ahead and get started. So hopefully everybody can see that. So today, yes, we are going to be diving into Medicare and Medi-Cal. I'm going to do my best to leave plenty of time for Q&A at the end because I know that there are probably a lot of questions. But first, really quickly, I do want to share a little bit about our organization, the Center for Healthcare Rights. We are also known as the HICAP program for Los Angeles County, which stands for Health Insurance Counseling and Advocacy Program. And that basically just means that we are a nonprofit organization that primarily focuses on free education and assistance related to Medicare. Obviously, lots of Medicare beneficiaries in LA County also have Medi-Cal. So we do provide counseling on other related health insurance coverage like Medi-Cal. Our agency primarily provides assistance over the phone through a telephone hotline. Our phone number is here on the screen. It will also be on my last slide. So the way that this typically works is if you have a question, for example, if I'm not able to get to all of the questions today, this doesn't have to be the only time you speak with either with me or someone at our agency. You can contact our toll-free number, schedule an appointment to speak with one of our registered HICAP counselors. And all of our services are free. We don't sell insurance. We don't sell anything. We provide neutral, unbiased information related to Medicare. And we also have some really helpful resources available on our website, healthcarerights.org. So without further ado, here is a quick overview of some of what we are going to discuss today: Medicare and Medi-Cal eligibility. We will also talk about benefits, what's covered. We went into a little bit more detail about Part D options and rights. And then we'll spend quite a bit of time towards the end talking about how Medicare and Medi-Cal work together if you have both of those coverages. And then, like I said, I will do my best to leave plenty of time for questions at the end. So first, who is actually eligible for Medicare? So most people become eligible for Medicare when they turn 65. So it's typically folks that have been paying into the Social Security system. So it says entitled to Social Security retirement benefits. That doesn't mean that someone's actually collecting those benefits yet. We talk to a lot of folks that are certainly working past 65, especially here in LA County where it's very expensive to live. A lot of folks are delaying, receiving their retirement benefits. If someone hasn't been paying into the Social Security system, maybe they were working from more informal jobs or didn't have work experience. We also talk to a lot of folks that do qualify based on their spouse or former spouse's record. But typically age 65 is when most people do become eligible for Medicare. Now, as we know, plenty of people also experience chronic illness, other types of disability. And so one other way to qualify for Medicare before age 65 is through receiving Social Security disability insurance benefits. Unfortunately, there is a quite lengthy waiting period before Medicare eligibility happens. So if someone starts receiving Social Security disability insurance, it's 2 years later. They have to be receiving those benefits for at least 24 consecutive months before they become eligible for Medicare. And there is not at this time any way to expedite that Medicare eligibility based on SSDI. Now, there are a couple of specific conditions that can qualify someone for Medicare more quickly. Those two being ALS, also known as Lou Gehrig's disease, or end-stage renal disease. But unfortunately, we do hear from people who have maybe been diagnosed with a terminal illness or with advanced stage cancer, for example, and unless they've been receiving SSDI for at least 2 years, or were granted it retroactively for at least 2 years, there's not really any way to expedite that in eligibility and enrollment. So before I get too far into Medicare, overview, I do want to clarify what the different parts of Medicare stand for and what they cover, because sometimes it kind of comes across as like an alphabet soup, right? So Medicare does have 3 main parts. Part A is hospital coverage. So that's inpatient hospital stays. If you're admitted to the hospital having surgery, you're there for, 3, 7, 10, 15 days, etc. It also covers home health care in certain circumstances, skilled nursing care in a skilled nursing facility, or hospice care. That is all covered under Part A. Now, Part B, as in boy, covers outpatient services. So doctor services, labs, x-rays, preventive care, right? Certain cancer screenings or flu shots or COVID-19 vaccines, outpatient therapy, durable medical equipment. That is all covered under Part B. And then Part D, I think, is the easiest one to remember because D stands for drugs. So Part D is the prescription drug benefit. So we'll talk a little bit in more detail about each of these different parts of Medicare and some of the costs associated. So before we get into what it costs, one of the main questions that we hear about on our telephone hotline is, when do I enroll, right? When am I required to enroll? When is the best time to enroll? Do I need to get into Medicare? So everyone who becomes eligible for Medicare has what's called an initial enrollment period. The initial enrollment period, again, typically around the 7 months around the 65th birthday month, but the initial enrollment period also applies when someone is becoming eligible for Medicare due to receiving SSDI benefits. That initial enrollment period is the 7-month period around the 25th month of receiving SSDI. So 3 months before, the month of eligibility, and then 3 months after. So it's not a matter of, oh no, I missed my 65th birthday. Am I out of luck? No, you might still have 3 more months after that to get into coverage. Now, the annual election period is what we all hear about. If you ever turn the TV on during the months of October through December, although now it seems like it's year round, that's when you're probably seeing a lot of commercials about change your Medicare plan, save money by switching to this plan. That annual election period is really just for making changes to Part D coverage, so the prescription drug benefit, which includes the Medicare plans, which we'll talk about. But in terms of enrolling in Medicare for the first time, that typically has to be done during the initial enrollment period or during the general enrollment period, January through March of each year. Now, if you are receiving SSDI benefits and become eligible for Medicare that way, you will be automatically enrolled. So you don't typically have to worry about enrolling in parts A and B if you are already receiving Social Security benefits of some kind. But if you're not yet receiving any Social Security benefits, whether that's disability or retirement, keeping an eye on this initial enrollment period is pretty important. And then there are certain circumstances where a special enrollment period might allow someone to enroll outside of that initial enrollment period. And one really common example of that is if you are currently covered by an employer health plan, either because you are still actively working or if you're covered through a spouse's employer health plan and they are actively working, you may be able to delay Medicare enrollment because of the way those benefits would coordinate. If it's a large employer, the employer plan is going to be the primary coverage, so you might not need to get into Medicare right away. But that's something, if there are questions about that, we can certainly discuss that at the end. Now, for Part A, as I mentioned, this says automatic enrollee. So for people that are already receiving Social Security benefits, whether that's SSDI or Social Security retirement, the Part A enrollment can be automatic and there is no monthly premium. So you're not paying anything on a monthly basis to have that Part A coverage. Now, for folks that have not paid into the Social Security system, maybe they worked for a public school district that paid into a different program, or again, maybe they stayed home and took care of the kids or don't have formal work experience. If there's fewer than 30 work quarters with Social Security, the monthly or I guess basically fewer than 40 work quarters, which is the threshold to get Part A for free, there can be a monthly premium associated with that. But there is a program for folks that have very low incomes and minimal savings where the state would pay that Part A premium. It's called the Qualified Medicare Beneficiary Program, and that's something that you apply for through the Department of Public Social Services, which also oversees Medi-Cal. So that is something that our agency also helps screen people for and enroll people into if you qualify. But I would say the vast majority of the folks that we talk to do get the Part A for free, no monthly premium because of the work history with Social Security. Now, Part B, on the other hand, does typically have a monthly premium. So the standard monthly premium this year is $170.10. So again, when we're talking about the premium, that's how much you're paying on a monthly basis just to be enrolled. That doesn't include whatever you might have to pay when you see a doctor, which we'll talk about in a minute. So this is the monthly premium. Now, for high income earners, there can be an additional sort of surcharge. So this is the threshold. It's based on your tax return from 2 years prior. So for this year, they're looking at the 2020 tax return. And if your income as a single person is over $91,000 a year, or as a jointly filing married couple over $182,000 a year, you're going to pay more than the 170 on a monthly basis. And there's a whole chart that I didn't include here, but that's called an income-related monthly adjustment amount. And so that's also something that we could certainly talk about in more detail if that's a situation that applies to you. Now, part of the reason I focused up front on those enrollment periods is because there can be pretty devastating consequences of missing an enrollment period if you don't qualify for one of those special enrollment periods. And I know that this gets really complicated. And so I typically say, if you have any questions whatsoever about whether or not you should enroll in Medicare now or delay, please call our agency. That is something that we have expertise on. I've heard of from some clients that they've spoken with private insurance brokers and gotten bad information about, I can take Cobra or this or that. Our services are free. It's always worth just double checking with us, because if you miss an enrollment period and don't qualify to get in to Part B, because of a special enrollment period, there can be lifetime late enrollment penalties. This is very punitive. It is 10% of the monthly premium for every full 12-month period that you could have had Part B coverage but didn't. So if you think about it, 10% of 170 is $17. So even if you just miss one full 12-month period, that's $17 that gets added to your monthly premium every month for the rest of your life. So if you're 65 and you miss a year and you're at 66, you enroll and it's, you add this premium and you live another 25 years, that's a lot of money that you are potentially paying for that late enrollment. So again, I say that to emphasize that if there are any questions whatsoever about whether or not you should enroll now or later, please give us a call and we can talk to you about your specific situation. Now, once you pay for Part B on a monthly basis, there are still potentially out-of-pocket costs when you go see the doctor. So if you just have Medicare only, no Medi-Cal, no secondary coverage, no employer coverage, just Medicare Part B, let's say, for example, there is a $233 annual deductible this year. That went up by about $30 from last year. And then the thing that we hear a lot, from clients is, I want to know more about this 80%, 20% split. What does that mean? So Medicare typically covers 80% of the healthcare costs associated with, seeking out services. And then if you don't have any other additional, secondary coverage like Medi-Cal or employer or retiree plan or Medigap, potentially you are responsible as the patient for 20% of those Medicare approved charges. So 20% of what? Who knows? It's very difficult to estimate ahead of time what you're going to be charged at the doctor's office, and what the Medicare approved charges are for the specific billing codes that they're going to submit. So it's pretty rare that we recommend that someone just stick with, straight Medicare with no additional coverage. And we'll talk about another couple of options to avoid that. And then depending on whether or not your doctor accepts what Medicare pays as payment in full, there could potentially be even additional charges on top of that. But there's lots of ways to avoid some of these out-of-pocket costs. Now, so that was Part A and Part B. Now, Part D, the prescription drug coverage, there are two main ways to get prescription drug coverage through Medicare. The first option is on the left side of the screen, which is original. It's referred to as regular Medicare, original Medicare, straight Medicare, fee-for-service Medicare. all of those things basically just mean that you are not assigning your Medicare part, your hospital and medical coverage to any specific insurance company or plan. You can go see any doctor that accepts Medicare. And then you sign up for a standalone prescription drug plan that only covers your prescriptions. And if you go this route, typically we do recommend that you either have Medi-Cal as your secondary coverage, you purchase a Medigap plan that can cover those copays and deductibles, or if you are covered by a retiree plan or something like that, that typically acts as secondary to Medicare. So this option offers the most flexibility about which doctors and hospitals you can go to, but potentially has the most out-of-pocket costs unless you have Medi-Cal as your secondary coverage. And don't worry, we will talk a lot about Medi-Cal in just a few slides. Now, the other option, which is on the right-hand side of the screen, is this idea called Medicare Advantage. And those are the plans that typically get pretty aggressive with their marketing, so many commercials, radio advertising, especially in the fall. If you're already on Medicare, you probably get inundated with mail. Again, probably year-round at this point, but certainly in the fall. And so the idea with Medicare Advantage is that you are assigning your Part A and B coverage to a private insurance plan that contracts with Medicare. And in LA County, all of the Medicare Advantage plans except two are HMOs, which means that they have a limited doctor network. You have to go to the specific hospitals that are part of that, have contracted with that plan. And the Medicare Advantage plans also typically provide the prescription drug benefit as well. So it's all wrapped up into one plan. Now, this model probably looks and feels a lot more like private insurance. So because it is, basically Medicare pays those plans on a monthly basis to cover you instead of you working directly with Medicare in terms of, payments and that type of thing. So, I would say one of the pros of going the Medicare Advantage route is that, if you need additional coordination, if you like, if you go through, like going through a primary care doctor to get referrals, sometimes it can make it a little bit easier to navigate that system. And also, Kaiser is an example. So if you've been, a Kaiser member, it can be kind of disruptive to change to a completely different network. Everything is sort of housed within the Kaiser facilities, right? So the benefit is, having additional maybe coordination, everything's all in one place, it's all within one plan, you're not keeping track of multiple things. And the other benefit is that because the plans operate the way they do, you don't need secondary coverage. So if you don't qualify for Medi-Cal, but you can't really afford a Medigap plan or don't qualify for any other type of secondary coverage, the out-of-pocket costs are typically quite a bit lower if you go through Medicare Advantage plan. Now, the downside is those limited plan networks, and especially for folks that are maybe living with cancer, cancer survivors might need additional services out of network, or more flexibility about which specialists you can go to or which facilities you can go to. Sometimes these Medicare Advantage plans can be a little bit challenging because it's very difficult to get any sort of out of network coverage for if you're enrolled in an HMO plan. So talking a little bit more about Part D, technically enrollment is voluntary. So if you have other prescription drug coverage that is just as good or better than the Medicare drug benefit. So for example, if you have VA drug coverage, right? Maybe you're a veteran and you have coverage through the VA, or if you have an employer-sponsored health plan that has, solid, it's called creditable coverage. Those are the magic words. If your employer plan offers creditable drug coverage, you can delay the enrollment into Part D as well. But if you just say, and I don't think this would necessarily be the case for anyone on this, webinar, but if I do talk to people sometimes who say, well, I don't take any prescriptions, so why do I need a drug plan? Okay, fair point. But if someone simply doesn't have any other drug coverage and chooses not to enroll or misses the enrollment, there is a late enrollment penalty for Part D as well. So it's 1% of the base premium for each uncovered month. Right now, for 2022, the average cost of a Part D plan on a monthly basis is around $33. So the penalty, 1% of that's 33 cents. So basically for every 3 months that you go without Part D coverage, it's basically another $1 of a late enrollment penalty. So it's always good to avoid late enrollment penalties if possible. Again, this is something we have a lot of experience counseling on if you have questions. Now for Part D, the standard deductible this year is $480. So with a deductible, that's how much you pay out of pocket before your plan kicks in. Now, I have seen that vary a bit. Some plans do have a lower deductible. Some of them have a $0 deductible. A lot of the Medicare Advantage plans have a $0 drug plan deductible. And then there are these coverage periods within Part D where basically once you've met your deductible, you're paying 25% of the total retail costs of the drugs. Now, again, that can vary from plan to plan because some plans, if it's a really inexpensive generic drug, some of the plans have opted, we're just going to have a $0 copay because it doesn't cost them very much. Or maybe it'll only be $1 or something like that. So it's not always 25%. This is just the most you can be charged for your medications. Now, because of the Affordable Care Act or Obamacare, the donut hole has closed. Back in the day, during this coverage gap or donut hole, patients were responsible for a significantly higher percentage of the retail costs of their medications. Now, as you see here, you're still paying 25% regardless of whether you're in the initial coverage period or coverage gap. And then once you reach a certain threshold, you can potentially reach what's called the catastrophic coverage phase, where you are either paying $395 for generics, $985 for brand name drugs, or 5% of the cost, whichever is higher. So, that's something to keep in mind, that it's not necessarily true that you will be paying this set copay amount once you reach the catastrophic coverage phase, because some medications are obviously very, very expensive. And I did speak with a client a couple months ago who was taking some medication that was like $20,000 a month. 5% of that is a lot more than $985. So that was potentially pretty problematic for him. And so when we do talk to clients who are facing very high prescription drug costs, we do like to screen them for what the Extra Help program, which is for people that have limited income, limited savings, and can help with some of these Part D drug costs. Now, really quickly, I know that there was a question that was posed ahead of time related to, what do you do if a prescription is not covered by Medicare Part D? So there's a couple of different options. So the first is that if it's just simply not covered by your specific plan and you are new to Medicare, or new to the drug plan, if it was covered by your previous plan and now it's not covered by the one that you just switched to, you are potentially entitled to what's called a transition fill. So that gives you a 30-day window to continue with your same medication that you had before. And then you can talk with your doctor about, are there other medications that are on the formulary for your drug plan, on that approved drug list that you could switch to? And if not, Another option is called an exception request. And so that's where your doctor does some advocacy on your behalf with the drug plan, letting them know, hey, I've prescribed this medication to Stephanie. She's tried all of these other options. She tried step therapy where, that's where you try other drugs and sort of fail before the plan will approve the drug that you want. But an exception request is where the doctor requests that the drug plan make an exception to what they approve because it is medically necessary for your condition. And I'll never forget, several years ago, I was doing a similar presentation, through my old job at Cancer Support Community Pasadena. And a participant raised her hand and she said, I got an exception request approved for 20 years. And she was already, I think, in her 80s. So she was very delighted to know that, when her time came, it wasn't going to be because she didn't have access to the medication. Typically, the exception requests are granted on a year-to-year basis. So it might be something that, if it's a long-term medication that you're going to be on, your doctor might have to advocate for you, each year. But that's typically one way to try to get something approved. If it is something that's then denied, there's an appeals process. If it's something that Medicare just straight up does not cover at all whatsoever, that can get a little bit more challenging. But if you have Medi-Cal, a lot of times you can get prescriptions covered through Medi-Cal instead of Medicare if it is something that is excluded from Medicare. And unfortunately, if you have Medicare Part D and or Medi-Cal, a lot of the patient assistance programs that are available through the pharmaceutical companies are not available to Medicare or Medi-Cal participants. A lot of those patient assistance programs are really helpful if you have private health insurance, either an individual plan or one through an employer. But for some reason, Medicare Part D and Medi-Cal beneficiaries are typically excluded from those. But there are also coupons available on goodrx.com and other options for trying to get, sort of discounts on medications. Okay, so moving on here, because I do want to make sure that I'm keeping an eye on time. So, we talked a little bit about Medicare eligibility, costs, and some of these are pretty big gaps for the clients that we serve, right? If they have to pay premiums, copays, and deductibles for all of these different parts of Medicare, that can really add up. I think a lot of people are surprised to learn that Medicare is as expensive as it is, right? People talk all the time about, Medicare and how valuable the benefits are, and I don't disagree with that, but I think the costs come as a bit of a surprise. And then in addition to that, there are some other pretty big gaps in Medicare coverage. So Medicare does not cover dental care. It does not cover routine vision, eyeglasses. It doesn't cover, hearing aids, incontinence supplies, transportation and medical services. And then a big one is, custodial nursing home care or personal care services at home, such as IHSS, which is a Medi-Cal program. So we'll talk a little bit about how else, some of these benefits that I just mentioned, that can be another benefit of getting into a Medicare Advantage plan if you don't qualify for Medi-Cal. Spoiler alert, everything that I've listed on the right-hand side of this screen is a Medi-Cal covered benefit. But for folks that don't have low enough income for Medi-Cal or are over the asset limit for Medi-Cal, which we will talk about, I promise, sometimes it does make sense if they really need, in-home supportive services to keep them in their home and keep them out of a nursing home. Sometimes, that's not actually a good example for what I was going to just mention. So let's say somebody needs eyeglasses, but they don't want to pay out of pocket, don't qualify for Medi-Cal. some of the Medicare Advantage plans offer additional benefits like vision coverage or hearing aids. And so that can be another consideration when trying to decide how you want to get your Medicare coverage. So what is Medi-Cal? Let's talk a little bit about Medi-Cal eligibility. I think probably some of you on the training today already have Medi-Cal. Some of you might be wondering whether or not you're eligible. So it's the state health insurance program that provides free health benefits. There are no enrollment periods to worry about with Medi-Cal. You can enroll at any time. The applications typically take up to 45 days. And then there are different groups of people that qualify for different Medi-Cal programs. So Medi-Cal is sort of the umbrella, and then there are all these different programs under the Medi-Cal umbrella that folks can qualify for. So if someone is receiving SSI, so supplemental security income, which is different than SSDI. And that's a really important distinction. So if someone is on SSI, which means they have very limited income, very limited savings, and then they're either 65 and older or maybe have a permanent disability, but don't have the work history to get SSDI, they get Medi-Cal automatically. They don't have to submit a separate application. It's just automatically linked. Now, for the rest of the clients that we speak with, we are typically counseling on one of two programs. So the first is the Aged and Disabled Federal Poverty Level Program, which is what I'm going to focus on mostly today. But the other program, which I think is really underutilized, is the 250% Working Disabled program. And that is something that we actually do talk to a lot of cancer survivors about, because the way that that program works is a lot of times if someone is receiving SSDI benefits, so that's Social Security Disability Insurance, long-term disability through Social Security, and that's how they become eligible for Medicare. A lot of times that SSDI income puts them over the income limit for this Aged and Disabled program. But with the Working Disabled program, and don't let the word working worry you too much. It's a very flexible definition. But the way that that program works is it actually does not count disability income towards the countable income to enroll in that program. So I'm not going to go into a ton of detail about that program in particular today, but if you receive SSDI benefits, or if you were receiving SSDI and they converted into Social Security retirement benefits when you reach retirement age and you need Medi-Cal, and you've been told that you have a Medi-Cal share of cost or your income's over the limit, this might be something you might want to contact us about, and we can screen you to see if you're eligible. And that is a Medi-Cal application that we do actually assist with submitting. So yeah, I'm happy to, I'm going to keep going through the slides, but I'm happy to answer questions about that at the end as well. So those are the two main programs that our clients, right? People with disabilities and people with that are over 65 or older adults. These are the two programs that we are typically counseling on. So the income guidelines for the Aged and Disabled Federal Poverty Level Program do go up each year. They just went up on April 1st. And so right now the income and resource limits are $1,563 dollars per month for a single person, or $2,106 per month for a married couple. So that's, quite low. And the resources right now, very low, right? $2,000 in the bank, $3,000 in the bank, depending if you're single or married. That's not much at all. And thankfully, California has realized that this is really unfair, because a lot of the clients that we speak to, especially those who are under 65, maybe have a disability or a chronic health condition like cancer, under 65, you don't have a resource limit for Medi-Cal. You can be evaluated under the MAGI Medi-Cal program, which only looks at your income. But if you start receiving disability benefits or if you turn 65, that's when they start looking at your resources. And it basically just feels like you're being penalized for either having a disability or being an older adult. So starting July 1st, the resource limits, and again, I don't think I mentioned this, but this does not count the house that you own. If you own a house and you live in that house, that's exempt. It does not count towards these resource limits. But they're going up on July 1st to $130,000 for an individual, $195,000 for a married couple. And then starting January 1st of 2024, there will be no resource limits at all for Medi-Cal. I'm going to let that sink in for a second because that is really big news. It's going to impact a lot of Californians throughout the state. You know, it's pretty typical that we will talk to someone who has minimal income, but maybe they got an inheritance and they had a settlement for an accident, right? And they've got $10,000 in the bank. Or they used to work a long time ago and they have a 401k that has, $17,000 left in it, and they've been holding on to that to, help sort of make ends meet. All of those things can make someone ineligible for Medi-Cal based on these current resource limits. So we are really excited about July 1st. If this is a situation that might apply to you where you are over this current resource limit, but under this new one, you could potentially apply in June and they would evaluate you based on the July limits. And then, potentially benefits could start July 1st. So you don't have to wait until July to apply based on these new resource limits. So if you have both Medicare and Medi-Cal, one of the questions we get a lot is, oh, well, I really like all my Medi-Cal benefits. A lot of folks are on Medi-Cal first and then become eligible for Medicare, either because they've been on SSDI for 2 years or because they're turning 65. And Medicare is always going to be the primary payer for something that is Medicare covered. So when we're looking at how they coordinate, Medicare is the primary, Medi-Cal is the secondary. If you have both Medicare and Medi-Cal, the state will pay the Part B premium for you. So that $170.10 should not be coming out of your Social Security check. You should not have to make any payments. And if you missed your enrollment and you might be facing a late enrollment penalty, well, if the state pays your Part B premium for you, you don't have to worry about late enrollment penalties. So that's another thing that we like to screen for. If someone is facing a late enrollment penalty, we like to see, do they qualify for Medi-Cal or one of these other Medicare savings programs to help cover those premiums, and then you don't have to worry about late enrollment penalties. Another really helpful thing is that if you have Medicare and full Medi-Cal, you cannot be billed for Part A and B copays or deductibles. So we talked earlier about how, if you have Part B, you might pay 20%. That doesn't happen if you have Medi-Cal. Medi-Cal covers your copays. You are not allowed to be billed for those copays. That would be called balance billing, and that's illegal. So I already talked about these Medi-Cal benefits. I'm going to keep going so that I can make sure I leave ample time for questions. But all of these things that we discussed before are Medi-Cal covered. So if you needed transportation to medical services, for example, you wouldn't use Medicare for that. That is something that Medi-Cal would cover. And in LA County, we do have a requirement that if you have Medicare and Medi-Cal, you typically do have to be enrolled in a Medi-Cal managed care plan for your Medi-Cal coverage. Now, if Medicare is your primary insurance coverage, this Medi-Cal plan does not impact which doctors you can go see, which hospitals you can go to. It's really only there in the background to help coordinate your Medi-Cal only benefits. Medicare continues to be your primary insurance. Now, when this move into Medi-Cal managed care happened several years ago, We did talk to a lot of people with cancer and cancer survivors who wanted to get medical exemptions from this Medi-Cal managed care because certain hospitals don't accept, certain plans. Currently, it's pretty rare to get a medical exemption from Medi-Cal managed care. But again, if you have Medicare as your primary coverage, you might have a lot more flexibility. Now, one other option, if you have both Medicare and Medi-Cal in LA County and 6 other counties throughout the state, is what's called Cal MediConnect. Now, I don't want to go into a ton of detail about Cal MediConnect because it's phasing out at the end of this calendar year, and we're moving into a new pilot project called Cal AIM. But basically, the way these plans work is it merges your Medicare and Medi-Cal into one plan. So instead of having your Medicare card, your Medi-Cal card, and you're trying to figure out how those benefits coordinate, it merges everything all into one plan. And then at the end of this calendar year, things are going to be shifting back to 2 separate plans within the same insurance company. So it's a little bit complicated, a little bit complex. These are called dual eligible special needs plans. When I use the term dual eligible, which is on the next several slides, I'm referring to people that are dually eligible for both Medicare and Medi-Cal. And I mentioned this already that, Medicare or Medi-Cal does not manage your Medicare benefits. Medicare continues to be your primary coverage, even if you do have Medi-Cal. Now, for Part D, patients or beneficiaries who have Medicare and Medi-Cal automatically get that extra help program that I mentioned a few slides ago. So it's called the Low Income Subsidy Program also. And if you are a dual eligible beneficiary with both Medicare and Medi-Cal, you're not going to pay more than $1.35 for generic prescriptions and $4 for brand name. So getting access to that extra help coverage can be really helpful in affording your prescriptions. If you don't have Medi-Cal, you can also apply for extra help separately, and there's a slightly higher income threshold and savings threshold, but the copays are a little bit higher. People with Medicare and Medi-Cal must enroll in a Part D plan. If you don't, sometimes we talk to people, they're like, well, I pay $0 for my prescriptions through Medi-Cal. I just want to keep getting my prescriptions through Medi-Cal. Unfortunately, that's not really an option. If you have Medicare, you are going to be required to get into a Part D plan because Medi-Cal is the payer of last resort. The state does not want to pay for your prescriptions if a Medicare drug plan could pay for them instead. So you would get automatically assigned into a Part D plan if you don't select one and you have extra help. These are the 5 plans that are currently available for people who have extra help, full extra help coverage, and they have no monthly premium. So even though there is this requirement to get into a Part D plan, if you have Medicare and Medi-Cal, you're not paying for the Part D coverage on a monthly basis. You do get enrolled into, and you can also select a plan. We help with Part D drug plan searches. We can help you figure out which plan makes the most sense for you based on your prescriptions. That's a pretty common thing that our agency provides assistance with. Now, we've talked about enrollment periods. All of the enrollment periods we mentioned at the beginning apply to making changes to Part D coverage. But for a dual eligible beneficiary, so again, someone with Medicare and Medi-Cal, or at least has the extra help coverage, there is this one other special enrollment period where you can make a change to your prescription drug coverage once per quarter for the first 3 quarters of the year. So folks that have extra help have a lot more flexibility about when they can change their drug plans. And for folks that have, again, chronic health conditions or critical illness, and there could be a change in the prescriptions that you are being prescribed by your doctors, having that extra flexibility can be really helpful. To make a change to the Medi-Cal plan, if necessary, that's done through healthcare options. And if you, as I mentioned, if you don't select a Part D plan, you will likely be auto-enrolled into a plan. Typically, there is also this newly eligible transition program, Linet, which might bridge the gap until you get into a drug plan. The last thing I want to mention before I open it up for questions is just that Medicare marketing violations and enrollment fraud is very prevalent. So if you do get phone calls or postcards or letters that you aren't really sure if they're legitimate, or if someone's making promises that sound too good to be true and is trying to change your coverage and tells you, oh yeah, of course you can continue to see your doctors. Oh, of course they're still in network. If it turns out that that's not the case, that is potentially fraud, and that is something that we work with the Senior Medicare Patrol to report and help fix. Unfortunately, there are some really unscrupulous insurance brokers and agents out there that are just out for their bottom line, right? They get a commission for every time they sell a new plan to somebody. So if you're concerned about any information that you get, or if you think that you've been the victim of fraud, you can certainly contact us directly or contact Senior Medicare Patrol. And so with that, I was able to leave 10 minutes for questions. So I'm sure that I see that there are at least 8. So I'm happy to open it up to Larissa to help me with the Q&A.
Hello, thank you so much, Stephanie. That was so much information in such a brief amount of time. So thank you for providing such a wonderful overview. And as you anticipated, we have quite a few questions here in the Q&A, so I will dive right in. The first question that we have is, what is considered assets when adding Medi-Cal to Medicare for under age 65? 401k, life insurance?
Yeah, so 401k, life insurance, money in the bank, stocks, bonds, those are the types of things that do typically count as countable resources or assets for Medi-Cal. If you are on SSDI or have a disability under 65, if you are not receiving disability benefits and you're under 65, there is no asset test. So that's something to keep in mind, that there is a distinction between which program you're eligible for based on whether or not you're receiving disability benefits.
Great, thank you. Our next question is if you could touch upon the 250% working disabled program.
Yeah, so the way let me stop sharing my screen so you can actually see me. So the way the 250% working disabled program works is there's a couple of pieces that are really important. So the first is, are you receiving some sort of disability benefits? So let's say you're getting SSDI and your income you're getting $2,000 a month from SSDI. That's probably going to put you over the income limit for the aged and disabled Medi-Cal program, but they wouldn't count it. The only money that they count for that program is either other unearned income. So let's say you're getting a pension or, some other, maybe passive income, you own a, rental property or something, and money that you earn. So earned income. And the requirements for that program are that you have some sort of work, which typically, honestly, is some sort of chore around the house or in your neighborhood for a friend or family member. You really just need somebody who's willing to write a letter on your behalf saying, Stephanie brings in my mail every day and I pay her $5 a week to bring in my mail. Or I have clients who are confined to their bed, right? They can't walk, they don't even use a wheelchair, but they have been enrolled in this program because one of them, somebody in the family would do the laundry and they would fold the laundry from their bed. Or somebody else would go get the mail and they would sort the mail for everyone in the household. So I know that there are typically concerns with SSDI that, oh no, if I'm working, that's going to put me, over the income limit for the SSDI, substantial gainful activity, all of that stuff. But this is typically very informal work. Um, you don't have to submit pay stubs. It's really just an employer verification letter showing that, someone in your household or a friend or family member or somebody has agreed to hire you to do some sort of chore. You submit that information. They don't count your disability income, and then you get access to full Medi-Cal benefits, and then there had been a monthly premium associated with being in that program. Most of my clients were paying $20 a month, but because of the pandemic, the premiums have been waived, and there is now movement to have them waived permanently. So it sounds too good to be true. There's a lot more to say about it. So if you are interested in the 250% working disabled program, I strongly encourage that you give our agency a call, because we're sort of experts in terms of helping people enroll.
Wonderful. Thank you. And apologies if you answered this part, because I'm not sure what IHSS stands for. But would someone for the Working Disabled program who also gets Medicare and Medi-Cal qualify for IHSS?
Yes. So IHSS is in-home supportive services. That's that in-home care where you're able to hire a caregiver to help with, stuff around the house, right? Meal prep, taking you to doctor's appointments, taking the trash out, stuff that's not like nursing care. And so that's actually a big reason why we help people enroll into the 250% working disabled program. If they have been approved for Medi-Cal with a share of cost, where they are told you're going to have to pay $900 a month before Medi-Cal kicks in, but all of their income is disability related, that can be one way to access all of those Medi-Cal benefits, including IHSS, without having to spend down a whole bunch of money.
Okay, thank you. All right, our next question is, if you're on Medicare and you add Medi-Cal as a secondary, does that basically meet the 20% that Medicare doesn't cover?
Yes. So that means if you have Medi-Cal as your secondary coverage, your doctors are not allowed to charge you anything out of pocket. If it's not a Medicare covered service, so let's say, I'm going to get a nose job or something, right? Like cosmetic surgery is not going to be covered by Medicare, then you would obviously have out of pocket costs. But if it's a Medicare covered service and you have Medi-Cal as your secondary, you can't be charged anything. The only caveat I will give is that if you have original Medicare, so that straight Medicare, just the red, white, and blue card where you're going to any doctor that accepts Medicare, you're not in a plan. The only caveat or warning is that some doctors that accept original Medicare will say, I don't accept Medi-Cal as the secondary coverage, and because of that, I won't see you as a patient. So that's something that I would investigate. I would ask upfront before making a new appointment, or maybe possibly before considering applying for Medi-Cal. If there are current doctors that you want to continue to see, I would ask their office, do you accept Medi-Cal as the secondary coverage? And if they say no, some of those doctors will still waive the copays. Legally, they cannot charge you. But I have also heard from some clients who say, I don't really care. There's this one eye doctor that I want to keep seeing because of my cataracts. They don't accept Medi-Cal as secondary. I've agreed to pay their copay. Technically, that's illegal, but we also understand that people want to have relationships with certain doctors, and I'm not going to tell you not to pay. I'll just tell you that you're not required to.
That's very good advice. Thank you for that.
Yeah.
Okay. Someone's asking if you can describe, I'm trying to understand the question, guaranteed issue. So no underwriting, no pre-existing condition exclusion. So guaranteed issue periods with respect to enrolling in Medigap plans or Medi-Cal as secondary insurance. I'm sorry, I'm probably butchering that question.
Yeah. So with Medi-Cal, You don't have to worry about pre-existing exclusions. Anyone can apply for Medi-Cal. You don't have to be healthy or disabled. It doesn't matter. For Medigap plans, which I did not just go into detail on, so Medigap plans are private insurance policies that just exist to pay the copays for Medicare. So for folks that don't qualify for Medi-Cal, maybe you have higher income, those plans, typically the best time to get into a Medigap when you have that guaranteed issue right. When a guaranteed issue right is when the insurance company is required to sell you a plan and cannot charge you more based on a pre-existing condition, or deny you based on a pre-existing condition. The best time to get into a Medigap is when you first have parts A and B. So it's typically that guarantee issue period is that first 6 months that you have parts A and B through Medicare. There are other certain circumstances that will open up a guarantee issue period for you down the road if you don't get into a Medigap at that initial 6-month period. But it can be a little bit more challenging. So if you have, for example, an employer plan, and the employer plan is acting as your secondary coverage, and then eventually you retire, right? And you get rid of the employer plan, that is typically another time that you might have sort of an open enrollment or a guaranteed issue right to purchase a Medigap. But if you just go the Medicare Advantage route for the first 10 years that you have Medicare, and then you get diagnosed with cancer and realize, oh no, I can't go to City of Hope anymore, or I can't go to City of Hope because it's out of my network, I want to switch to original Medicare with Medigap, that's where you can run into a lot of issues because you have a pre-existing condition. Those Medigap plans, because they are not health insurance, they can potentially deny coverage based on pre-existing conditions. But that's also something, if there's more questions about Medigaps, please feel free to contact us. That is something that we do provide counseling on.
Yeah, thank you. It sounds like this can all get very confusing. So I'm so grateful that you're here talking on this today. And I urge all of you who are here to reach out if you have any specific questions, because it sounds like it can be very based upon your personal situation, correct?
Yes, it is not a one size fits all situation. Some of the commercials on TV make it seem like everybody qualifies for this, or this is the best option for everybody. And it really does depend on your financial situation, which doctors and hospitals you prefer to go to, potentially your health status. I mean, that can have a huge impact on which plans make the most sense for you or which models of receiving your coverage makes the most sense. So that's part of why we provide one-on-one counseling, so that we can tailor the information to your specific situation.
That's such a wonderful resource. Okay, we have time for a couple more questions here. Mm-hmm. We have 2 people who are asking about the Medi-Cal resource limit and when this is being phased out.
Yeah, so we're so excited about this. So the first step of this process is July 1st. That's when the property or asset limits are going up to $135,000 for an individual, $195,000 for a married couple. And then it's an additional $65,000 for every other family member. So, I guess potentially if you have a minor child living in the house, it could be another $65,000 on top of that. Effective January 1st of 2024, no more asset limits, period, for Medi-Cal. And again, I know it sounds too good to be true. And I've had a lot of people say, I'll believe it when I see it, but it's happening. It's happening. So we're very excited.
Very exciting. So the first stage starts July 1st, and then it will be full-time in January 1st to 2024, correct?
Yes. Mm-hmm.
Okay, wonderful. Thank you.
Yeah.
I think we had one more question on the assets while we're on that topic, is do 401k and pension life insurance count even if you can't withdraw them yet?
Yes. So that does potentially count towards the asset limit. That is something that you would have to disclose. There is a when you're submitting an application to Medi-Cal, they do ask for bank statements and, sort of a list of your assets.
Okay, great. All right, our next question is, during hospice, does Medicare limit the amount of nursing care or number of patient visits by nurses? And if so, what is to be done if more nursing care is required than what Medicare actually covers?
Oh gosh, this is such a tough question because I think part of the issue is that, yes, hospice care through Medicare is not 24-hour care, and it is typically care at home. It's not often inpatient because it doesn't typically cover room and board. So there may be a limitation as to the number of hours or the number of visits that are able to be covered. And I think the other component of that is that there is a serious shortage of home health aides and nurses. So I think, anecdotally, I have heard from clients and families that they were alarmed at how little support they've received throughout the hospice, experience in terms of the at-home care, which is truly heartbreaking. If additional care is needed, there is, private pay is always going to be an option. That doesn't mean it's affordable. Medi-Cal can sometimes provide additional assistance, whether that's through in-home supportive services or if someone, really is not able to be cared for at home, potentially in a nursing facility. But the hospice benefit certainly helpful, but it's not 24/7 care, and that can be really challenging for families.
Oh, that sounds like such a uncovered area that's caused a lot of issues.
Yeah.
Okay. What is emergency Medi-Cal and how long does that coverage last?
So emergency Medi-Cal is typically available for people who are uninsured and or do not qualify for full Medi-Cal for some reason. So one thing I didn't mention is that one big change that's happening May 1st is for adults age 50 and older who are here with unsatisfactory immigration status, so maybe undocumented, will be eligible for full scope Medi-Cal starting May 1st. So that's huge because, at my old agency, we would hear from undocumented immigrants who went to the emergency room. So emergency Medi-Cal will cover you in an emergency. You're in a car accident, you break your arm, something like that, right? But sometimes we would hear from folks that went to the emergency room and were diagnosed with cancer. Chemotherapy is not considered an emergency, which is ridiculous, right? But that's the limitation of emergency Medi-Cal, is that it really only covers you in an emergency. I'm not entirely certain how long that coverage works because we don't typically work with emergency Medi-Cal. In order to be eligible for Medicare, you do have to have satisfactory immigration status. So we don't serve a lot of undocumented immigrants. But yeah, that's one of the limitations, is that it really only covers you in an emergency. But now, thankfully, at least older adults, 50 and older, will be eligible for full scope Medi-Cal.
Great. Okay. We have 3 more questions. Do we have time to go through those?
Sure.
Okay. Does it make sense to get Medi-Cal if they have private insurance? They are a cancer patient.
So I think it's going to depend. If you have private insurance, if it's through Covered California, they've probably already evaluated whether or not you're eligible for Medi-Cal, and put you into a Covered California plan, and hopefully you're getting some tax credits to make that more affordable. If you have employer coverage, the coordination of the two benefits can be pretty tricky. And with employer coverage, there are typically only certain times of year, during the employer's open enrollment period, that you could either drop the plan or stay in. So I think that's like a sort of a long-term decision that you would have to make. Typically, through private insurance, you might have access to different or better hospitals. If it's through an employer plan, as opposed to Medi-Cal, which, is a great benefit and provides all sorts of coverage, and it is free, but, sometimes you might not be able to see the doctors or go to the hospitals that you prefer. And if anyone's been paying attention to the news, one of the biggest Medi-Cal managed care plans in LA County recently got some pretty hefty fines for some delays in medical care, especially for people with cancer and other, critical illnesses. So pros and cons. Again, not a one size fits all situation.
It never certainly is it?
Yeah.
Okay. All right. Our last two questions. If a person is 65 and they're still working, so they've delayed their Medicare Part B enrollment, what is the smoothest way to then transition to Part B when they retire?
So I would say if the person knows when they're going to retire, I would recommend starting that enrollment process into Part B probably 2 months before retirement. So if I know I'm retiring on July 1st, probably during the month of May is when I would want to start and doing that enrollment with Social Security, because you will have to submit documentation that your employer is going to have to sign showing that you had continuous coverage through the employer plan. And that can take some time just to coordinate, get them to sign it. And then you can request, okay, my coverage is ending June 30th because that's when I'm retiring. I want Part B to start July 1st. And then you've got plenty of lead time to do that. So that's my recommendation for someone that's planning to retire, to start that process and maybe give us a call, 2 months, 2 to 3 months ahead of time.
Great. Wonderful. Thank you. Okay. And our last question, so we won't keep you too much longer. If someone was just asking that, when you say original Medicare, what other types of Medicare are there?
So original Medicare, if you remember the slide I showed, there was the two sort of models, right? Original Medicare is that one where you've got just your red, white, and blue Medicare card and a standalone drug plan, Part D drug plan. And then maybe you have some other type of secondary coverage. The other model, the other comparison to original Medicare is the Medicare Advantage plan, where you have assigned your Medicare benefits to a private health insurance plan, typically an HMO. So limited plan networks, but maybe lower out-of-pocket costs.
Okay, that certainly makes a lot of sense. Thank you. All right, well, that's all the time we have for questions today. I'm certain that all of you who are still here with us probably have a ton more questions. So I'm going to, Stephanie, if you don't mind giving me that phone number one more time, I will type it into the chat for anyone who didn't get it before.
Perfect. So our toll-free number is 1-800 824 0780.
Okay, wonderful. I have typed that into the chat. So that's 1-800-824-0780. And so if you have any further questions, please feel free to give them a call. We are so grateful for you being here and talking with us today. And we look forward to getting this edited and thrown up on our video library, so future participants can watch as well. So thank you so much, Stephanie.
Yes, thank you so much for having me. It was a pleasure sharing this information, answering questions. And please know that if you call our toll-free number, you don't have to ask to talk with me. We have other really wonderful registered, trained counselors. And we also have some volunteer counselors that are out in the community that do one-on-one counseling in person. So if that's your preference, that is something that you can certainly ask about as well. Not all of the counseling sites in person have reopened, but some of them have. Some of them, I know that there's at least one person in Santa Monica. So if you prefer to go somewhere local as opposed to calling, feel free to call us and we can try to connect you that way.
That's great. I think we've all gotten pretty used to hybrid models. So it's nice to know that both options seem to be available.
Yeah.
Wonderful. Thank you so much, Stephanie. And thank you to all of you for being here with us today. And we hope to see you again soon.
Thank you. Take care.
Take care.